Welcome to
the InVita Effect.
We did it.
We did.
All right.
Hopefully you can hear me this week.
Because I'm talking into the microphone.
And I'm not sick this week. So
Oh my gosh,
my
I
voice
know.
isn't cracking.
She is over the plague. Thank you, baby
Influenza.
Jesus.
Lord.
It's
yes.
bad. It's so bad.
Really bad this year.
So I guess that kind of would be a great segment to say if you are someone who, thinks you have influenza, strep throat, sinus infection, something that you need urgent care type stuff for,
Yep.
you can
Bladder
come in.
infection, any of those
Yep,
things.
you absolutely can come into InVita Health and Wellness, and we will take care of you. Granted, we are open Monday through Friday, 9 until 4:30. But you are welcome to give us a call first, drop in, and we can take care of those urgent care visits.
We take same days. I know a lot of urgent cares ever since kind of the pandemic have switched over to you sign up, which kind of defeats the purpose of it being an urgent care visit.
Does.
So you can just walk in or just call on your way and we can get you taken care of.
Yep. And we'll get you in, get the testing done. And we also have, you can use your insurance if we accept your insurance, and we have cash pay prices, which are more affordable and typically even cheaper than going to urgent care. So,
and we've seen that question a lot circulating on social media too, by the way. It's, why did I get a bill for $150 just for the flu swab? Is this normal? Where I've seen that now 5 different times just in the last couple of weeks. And, questions about where can I go that it's not going to cost me my right kidney to pay for this visit. So we'd love to help you. With that being said, I think it's a great segue to kind of talk about just general wellness. Don't you think? A lot of patients and what we've experienced taking care of patients is a lot of them will wait, unfortunately, because things can be so pricey when it comes to the healthcare industry. And so they wait a lot of times until they're literally falling apart to walk into the office. And I think we were really good about this, or some people were really good about this. I keep going back to the pandemic because a lot of people started getting worried about, oh my goodness, am I going to get COVID? What can I do to keep myself healthy? And there was a way bigger kind of push to be preventative, which is not how healthcare, unfortunately,
healthcare is reactive,
right?
100%
you wait
reactive.
till something happens. It's reactive medicine. We want that proactive preventative medicine. So what would you tell your patient then, Chris, that comes in and says, what should I be doing to keep myself healthy? What are some of the screenings or just some of the things in general that you would want them doing regularly? Things like wellness, we do IV therapy, like any of those types of things.
I mean, obviously, one of the most important things you can do. And, admittedly, I was a single young mom. I was busy trying to keep food on the table and do a lot of stuff. And I didn't really stay on top of my yearly exams myself.
Right.
Yeah. So I always try to have that conversation and be like, hey, I understand, you're young, you're busy, you're moving kids around, but it's important to get in and at least do that yearly exam. Get that blood work, see where you're at, because really a lot of the prevention takes place in your 20s to prepare you for your 40s.
Right.
You can't be 35 or 40, have high cholesterol, and then all of a sudden start treating it, because it's a 10-year risk. That's what they look at. It's a 10-year risk, right? So if I'm 25, that's going to project for me where I'm going to be when I'm 35. So you really need to think about that. But again, when we're 25, 30 years old, we don't really think about when we're going to be old and 40.
Right. And one of the things with the cholesterol too is if it's exactly years of uncontrolled levels, and we don't know if it's years of uncontrolled levels if we're not checking and having that year over year comparison. So we do recommend getting those fasting labs. We can do the lipid panel. We want to check the fasting blood sugar, look at liver markers, kidney markers, electrolytes, a complete blood cell count, just making sure that there's no abnormalities that we can see in the blood. Are you showing signs of anemia? Do you have a history of anemia? One of the other things that I get asked a lot about is the cholesterol panel, the just standard lipid panel. And there's been luckily a lot more research about really assessing a patient's cardiovascular risk. And unfortunately, our just standard lipid panel doesn't always tell us all that we need to know about that patient. So we do offer some of the more specialized lipoprotein A, LDLP, the HDLP, and those are levels I would encourage you to look up if you've never heard of those before. One looks at our genetic marker risk. And let's say if we have a strong family history of heart disease on mom or dad's side, well, if they carry that genetic marker and they have 4 kids, all 4 kids could have picked up that genetic marker from either mom or dad's side. Only 2 out of 4 kids could have picked up that genetic marker. We don't know unless we check, and that's kind of a one and done check. It's something that can be really helpful so that your provider can really understand what your heart risk is.
Right. And again, that's preventative. That's
yes.
not, okay, now I have a blocked artery. Okay, now I have to go in and get a
Here's
heart
your
cath.
5 medications you're stuck on.
It's more about, okay, I'm assessing my risk. And I think like some of the doctors that I listen to and the podcasts that I listen to that are more preventative, they're like, yes, you have this genetic marker, but no, it doesn't have to rule you.
Exactly.
There are things you can do to change the trajectory of your health, but you have to do them early. And I think like what you said, like doing that CBC and doing that lipid panel and seeing what your A1C is, you know, that your blood sugars over the last 90 days, doing that insulin resistance and just doing an overall well check. If you don't have insurance, we do that. It's less than $200.
Right. The thyroid panel, that's huge. How many people don't look fully at
and
the
you can
thyroid?
add on extra labs for, you know, what I tell people, I'm like, you typically, if you go out to dinner, have dinner nowadays and a couple of drinks, you're going to pay at least $100 easy.
Right. And you're worth more than that, right? Your health is worth more than that. And one of the conversations, especially, you know, surrounding heart health that I have with patients is I don't ever want there to be that situation where, God forbid, you end up with that heart event, you end up with that heart attack, you end up with the stent, open heart surgery, whatever it might be. And now you're no longer in control and in the driver's seat, right? You're backed up against a wall. You get the blood pressure med, even if you've never had a diagnosis of high blood pressure before, you get the blood thinner medication, you get, you know, all these meds thrown at you. And some of the cholesterol medication that they're going to put you on, whether or not you've had a history, or maybe you don't know because you've never had the levels checked, some of those at the doses that they use can often cause joint pain. And so now we have loss of heart muscle and function that we can never get back. We have side effects we have to deal with that unfortunately affect our quality of life. And we want to be in the driver's seat. We want to be the ones in control, where if we have that information ahead of time, yes, you might end up with that looking and seeing, hey, I have that genetic marker. But like you said, Chris, that doesn't define everything. You still are in the driver's seat and making those decisions on your terms. And we have time on our side and we can start working against those things and working to fix those things.
Well, and it's risk prevention. I mean, you can do risk prevention when you're driving your car. You can do it, you know, when you're in your home. Do I lock my front door when I go home so that there's less of a chance of it getting broken into? You know, your health is the same way. There's risk prevention. Just because you carry the genetics, just because you're predisposed to it, doesn't mean it has to happen. There are things you can do to, you know, prevent it or make that risk a lot lower.
And not everything truly, as far as some of these screenings, there's several of them that insurance obviously will cover, unless you have a high deductible plan, which it feels like it's everybody nowadays. But even going back to heart health, there's, you know, I talk a lot about CT calcium scores. That's one of the most common questions I get.
I think that is the coolest test.
It is one of
and
the
I went and did
tests.
it, and it was like in and out.
Yes, and it's cash pay. You know, and we work.
It's like $100.
Yes, we work closely with clinics that offer these at special cash pay prices for the patients because they know insurance doesn't cover it. And there's research studies out there. We're not just doing this test just for fun. There's research studies out there that say, yeah, you can look at the cholesterol panel. You can calculate that 10-year cardiovascular risk, looking at their cholesterol and all these other factors. What's their blood pressure? what's their weight or BMI? Are they a smoker? Do they have family history of heart disease? But it's even more helpful when you add in that extra piece, because how much calcification and blockages are we talking about?
Right.
What is your calcium score? And if it's almost nothing, great. We at least have our baseline study now set up, again, being proactive and preventative. And we can reassess or decide, do we need to check this again in X amount of years? Versus I had a patient that was it was the highest calcium score I've ever seen. Sent that patient to cardiology within the week, and they were someone that ended up needing stents, multiple stents. But guess what? They didn't have the big heart attack. They
Right.
got ahead of it, and they had no idea because they were already in their later years by the time they were even thinking about this test. But just think about if we start implementing some of those things to take care of ourselves
Yeah.
early on.
Well, and when you talk about the next step would have been a heart attack. And that's,
Yes.
I'm
Yeah.
rushed to the ER.
I lose heart muscle now.
Yep. I
and
lose heart
function.
muscle. The cardiac team comes in. I have to do cardiac rehab.
You're not
I
in
have
control.
to get stented. It's very invasive. All of that
Yes.
is very, very invasive. This calcium score that you go in and get, you literally go in, you lay on a table. I would say it takes less than a minute.
Yeah.
Zip, zip.
Yeah.
They look at you and you're out the door. And then you just wait for your result for your provider to read it. And I mean, I've sent quite a few patients to go get them. And it's so easy.
Yes.
Like I had one patient who's like, listen, I didn't tell my primary care doctor I've been a smoker. And sometimes I still do in the summer.
Yeah.
And I was like, okay, well, stop it. That's not good for you. And I'm like, but thank you for telling me. And so we sent them to go get that calcium score. And it just made them feel better because they really had a big family history of it. And they
Mhm.
were also probably not doing all of the best things for themselves. So, but that prevention, I think, is really important.
Super important. The other screenings, that we'll talk about with patients regularly, things like your mammogram screening, getting those starting at age 40. We can have the conversation with patients that go, well, I don't want a mammogram. Why won't insurance just cover an ultrasound? Or can I get a thermogram? Those are things that we'll go through with each patient and talk about their individual needs. What about colonoscopies? You know how many patients that I still encounter that have never done their colonoscopy or didn't know that the age changed from age 50 to 45? Chris.
Hi, my name's Chris, and I haven't been following the rules, but I'm in the bullpen. I'm going to go get my colonoscopy.
We got it ordered.
Maybe we'll make a whole podcast about it.
Yes, we got it ordered for her, but she's getting back on track, and that's the main thing is that a lot of patients, 10, 20 years over the age where they should have started screening are just now walking through the door.
And the thing is, the one thing I think our patients know about me, I will admittedly say, and I think in general, but healthcare workers, we are the worst patients. We are so busy being caregivers and taking care of everybody else. We don't do the things that we should do for ourselves. So, getting that preventative screening, it's not a big deal. It's really not a big deal. And so my sister, who's 4 years older than me, she needs one too. So we're just going to make a day of it. I know that sounds great, but we're going to go get colonoscopies together. My poor husband is going to drive us because he's up to date on his. And
well, and even let's say
it's just an important screening. It really, really is. And people will ask, why can't I just get the Cologuard?
Yes.
What do I need the colonoscopy for? Why can't I just do the Cologuard? I do not want a colonoscopy.
Right. And those are going to be case by case, just analysis that you need to just kind of talk through. What is that patient's history? Well, you don't qualify for a Cologuard because you have a family history of colon polyps, or your first degree relative had colon cancer even. And so you really aren't a great candidate. Either way, I'm just flat honest with patients. The most accurate test is going in and looking. But
because you can visualize
this technically stage zeros, right?
Mhm.
Those early start of cancers. But at the end of the day, I also want to order the test that my patient's actually going to complete. It doesn't help if I just go, here's your colonoscopy order, and they never
make that phone call. Yeah.
So if the only way to do any type of screening is going to be getting them to do the Cologuard, okay. At that point, some screening is better than no screening.
But I think, like you said, I think people need to understand that the Cologuard is great. It's great to do that screening, but it doesn't take place of actually
of the
laying eyes on it,
actual colonoscopy.
being
Yes.
able to see, being able to go in, get those stage zeros, get those things early on.
Yeah.
And again, it's mitigating that risk.
Well, and I've had patient conversations where they're like, yeah, I'm still not going to do it, but I'll do the Cologuard. And if something comes back abnormal, then I know I have to
Yeah.
or should go get that colonoscopy.
Which,
okay. Again, I'm here to order the test to actually
Right.
get you screened
And
in
order
some
them-
way, shape,
yeah.
or form and make sure we're taking care
order
of
the
you.
meds you're going to take.
It's
Like,
same. Exactly. Exactly. So then, okay, we talked about mammograms, colonoscopies.
I just wanted to say about the mammogram is, a lot of people don't want to go because mammograms now are much more affordable. Most insurance companies will cover them.
Yep. You should be getting a 3D mammogram, which
Yep.
almost everyone's using that technology now.
Yep. And if you don't like going to a big hospital to go get it done, if you don't have insurance, we do work with a really good imaging center. It's actually where I went for my mammogram this year. And again, easy peasy,
You have lots
in,
of options,
out,
yeah.
not painful, quick, fast. And they had really nice fluffy robes.
There's also actually a state program too that we could always look into if you're like, I'm uninsured and I can't afford the mammogram. There's the Every Woman Matters program. There's different things that we would be able to at least have you check out to see if you would
Yeah.
qualify for those screenings where
Right.
you don't have to pay for that.
Right.
Because
And
everyone really should be getting these screenings.
100%. So then that kind of leads us into, since we're already talking about screenings, what about pap smears?
So pap smears start at age 21, regardless of whether or not you are or have ever been sexually active. That is something that is done usually every 3 to 5 years. I know at my gynecology office, they're checking everyone every single year. It's just a conversation to have with your provider, but it's one of those things, if you've never been checked, go get checked. One of the things, I don't know if you saw this recently, there was actually like a TV personality star recently that had brought up that she was diagnosed with colon cancer, cervical cancer. And I don't know if you saw it or not, but that it was just a great PSA to people. And the amount of women that jumped on there and were like, I haven't been screened yet. Thank you for this. Yeah. I'm going to go get
And
screened.
she had numerous abnormal pap smears.
Yes.
I just want to say that
Yes.
she was being followed and had, from what I read,
right.
It's what I'm thinking of. She had numerous abnormal pap smears that showed HPV.
Yes.
And that she, I think they were able to catch hers fairly early.
One of the earlier stages.
And she was in that demographic that could not get the HPV vaccine.
Right.
And so they did it was a great PSA too about, hey, here's this option to get this vaccine, for your children or young adults, because that she was right at that age group, like 35, that it wasn't out yet.
Yeah.
Which I thought was really interesting.
The guidelines for how old you can be, because we used to rush and get it by this age, and we raised that ceiling now.
It's like 25 or 26 now. It's quite a bit older.
And there's just, and again, this isn't us saying you have to go get the vaccine. This is do your homework. Go in, have that conversation with your provider. Is this right for me? Or is it good enough that I'm getting in and just getting screened and doing my PAPs and doing that regularly versus I'm not doing them at all and leaving it all up to chance.
Yeah.
And we want you guys in control of your health.
Yeah.
And doing these screenings gives you that control.
And then I know, like, okay, 21, I go in, I do my PAP, 1 year, 3 years, 5 years, whatever. Then I have babies. And of course, they do it for you at your, 6-week visit, send you home. And then you get your reminders. But then you kind of fall out of, I'm not having babies anymore. I'm not necessarily going to my OBGYN as often. Now, how often do I have to be screened and through what age?
Yeah. So you should still be getting screened every 3 to 5 years, depending on if they are, and that's the ACOG kind of recommendation. And we should be checking HPV and looking at that. But we're also just, even HPV aside, even if I have a patient that's like, well, I've been with the same partner the entire time.
Men can carry
Why
it.
do I need to worry about HPV? Well, we're also too doing an analysis of the cells. Cells anywhere in the body for any reason can change and become cancerous or precancerous.
Go rogue.
So, yes. And so we're looking at that. Even if you do a PAP without the HPV portion, getting a regular PAP and looking at the cells is still important. And the recommendation right now is until age 65, unless obviously
I'm so
you
close.
have had a hysterectomy or don't have a uterus anymore. As long as it hasn't been removed due to a cancerous issue, then some women still have to get some exams after that. But obviously, you're talking with your oncologist or your surgeon at that point and making that plan. But really just getting in, because I can't tell you how many times, even for myself, I was like, it has not been 3 years already. It flies by.
Yeah,
and
if you don't
just
get the
even think about
reminder,
it.
if you don't get the reminder again,
Yeah.
you get busy and life is lifing
Life is
and
life and hard.
you don't think about it. But yeah, I
But
mean, that's
most
good through 65,
Yep,
still every 3 to 5 years.
yep,
And I feel like a lot of women hit menopause.
yep, and they're just done. Well, and I catch a lot of those as they come back and we go, "Okay, you're 62 or you're 64 and you haven't had a PAP in 10 years." And I'll have all the ones before that been normal? Have they been abnormal? Do we need to check and do, 3 the next 3, and then as soon as those are all negative and they're good, then we can discontinue? Or have they all been normal to where we can do at least one more and then we can
Yeah.
discontinue? But having that conversation again with your healthcare provider is so important.
Yep, totally is. And then for men, PSA, the prostate antigen.
And there's not a great recommendation or guideline for the age. And so I personally start checking that PSA level at age 45. But again, as you're doing your physical, your wellness with your provider, they should be asking a lot of that history. If I have a patient that has a strong family history of prostate cancer or other types of cancers, I might have
Do
other
it
things
earlier.
on my brain as far as, okay, we need to do these screenings early. If let's say, for example, even with colon cancer, well, dad had colon cancer or even a precancer and he was 45. Well, we might start screening you in your 30s and get you over to GI early. And hopefully at that point, the GI provider who was treating dad also already told him, hey, make sure your kids are getting in early and getting screened. But that doesn't always happen. And so we get you in earlier for certain screenings based on your family history. Same with prostate cancer. Oh, well, dad had a prostate cancer at 50. Well, then maybe we start checking at 40, and so those are the conversations to start having. And there's a lot of, again, it's that prevention and just educating the patient during those visits of, okay, well, my male patient, if you have changes in the urine stream or, weaker urine stream, any of those changes, I want you letting me know. And it's one of those things where you don't know, or they don't know to kind of come back in and talk about that. They might just think, oh, it's just something that happens over time, not a big deal, because there's not necessarily pain associated with it. There's a lot. I had one friend actually that we knew with a testicular cancer in his 20s. And nobody had ever told him to do a testicular check each month.
My cousin was like 17 or 18.
Yeah.
Yeah.
And these are the things we should be talking to our teens.
Yeah.
And our young 20-something-year-olds of do that check monthly and make sure there's no new growths or changes. But again, these are the things we can capture during your wellness exam and get you that information so you can be proactive. You can be on the lookout for those things. Doesn't matter if it hurts or not, if it's new. Those are the things we want to know about, right? Same with the breast exams and checking those at home. I can't tell you how many women in those 11 months in between their mammograms, right? There's a lot of time in between those year after year. They might find something. I've had patients wait to see me in some cases because they found a lump, but it wasn't painful. It doesn't matter if it's painful.
It
If
needs to
it's
be
new,
investigated.
we need a look. Yes.
Yeah.
Exactly.
And I think too, for self breast exams, I always tell my patients, the easiest place to do it's a shower, right? You're in the shower, pick the same day, the first of the month. Oh, first of the month. Okay. Do that self breast exam and then it's done. Right. And then you don't have to, I forgot I was doing it on the 15th or I was doing it.
In your phone, do something. So if you're visual like me and you're like out of sight, out of mind, if I don't have that reminder in front of me, I won't remember to do it. Yep. Put a reminder in your phone, put a sticky note on your mirror in your bathroom, literally something that gets you to remember, oh yeah, I haven't done that yet this month. Let me check.
Yep.
Because those save lives. I will tell you, I can't even stress the number of patients that, and mammograms are so important. They are, but the number of patients that have found something at home with their own check come in and it's a precancer or cancer, and we caught it at some of the early stages because they were checking each month at home.
And I guess that kind of leads me into saying, if you find something and you go and you ask for it to be looked at and you are dismissed, do not stop.
Right.
Advocate for yourself. I'm not saying that all providers would do this and all providers are bad. That's not what I'm saying. But what I'm saying is, a friend of mine had babies and found, well, she was young, found a lump in her breast, went to the doctor, and they said, "It's fine. You're just breastfeeding." And she said, "No, it's not that. It's something else." "No, you're fine," and dismissed her. And she was like, "Absolutely not." And she went to someone else and she was found to have breast cancer, had to go through chemo, lost all her hair. I mean, everything.
But she went somewhere else.
But she went somewhere else. But that's the point.
Yeah.
But I mean, you really, really feel like if I go see someone and they dismiss me, then I'm good. I did my due diligence. Don't stop until someone agrees to help you and look at it. Look at it. Those lumps need further testing. If the provider you go to won't do the further testing, find somebody else. Advocate for yourself. It's not you being obstinate. It's not you being non-compliant. It's you caring about your health and advocating for yourself.
100%.
And that's with everything.
Yes. Yep. So I think those are the main screenings. But again, just getting your physical scheduled, doing your fasting labs, having those conversations and figuring out what's your family history, what does your personal history look like, and then getting yourself taken care of. I think those are the most important things that you can do truly so that you're not in a state where my health is falling apart. I don't know what's going on. Let's try and figure it out. And we're starting way, way behind, right?
Right.
Instead of we've been in the driver's seat this whole time and we know what's going on and we can catch things as we go.
Yeah. It's like starting a marathon 20 minutes behind everybody else. You know, you're probably not going to catch up. I mean, if you were running against me, you would catch up, but otherwise you're not. But yeah, I think the biggest thing is just, you know, for us as a clinic, we want to help people be preventative, you know, because if your concern is truly money, being preventative is a lot cheaper than stay in the hospital. Being preventative is a lot cheaper than having to go to a nursing home or get care. You know, being preventative is a lot cheaper than losing your life and leaving your loved ones alone, you know, with no contingency plans because, well, I was young and I was invincible until I wasn't.
Right. And I think too, just a plug for moms, because being a busy mom myself, it's very easy. And you've mentioned this too. It's very easy to take care of everyone else around you and literally give every last ounce from your cup, even from an empty cup. Somehow we managed to do it. But your kids deserve the happy, healthy version of you. And you deserve to have that quality of life. You deserve to live life to its fullest and to be your healthiest version and be able to have the energy to do the things that you want to do.
Yeah. And I think as a mom, it's hard because if I leave my kids to go to the gym, I'm being selfish.
Right.
If I take my time away from my kids to go to this doctor's appointment, I'm being selfish. And it's just not that way. It's sure, you're being selfish maybe with your time, but you deserve that because in the end, you're going to give them the healthiest version of you, which is going to give them the longest version of you.
Well, and again, my favorite question that I ask all patients now, but especially women, is what is the one thing that you're doing weekly for yourself? And a hot shower doesn't count.
Yeah.
One thing. And I can't tell you how many times I'm just met with silence.
Yeah.
You know, and they have to think about it and they might go, well, there's nothing on, you know, if I told you write down on a piece of paper and what's the one thing that you do just for you? And if that paper is blank, we're not doing it right. Yeah. And again, it might feel selfish for the first couple times, for several weeks or months or whatever. But eventually, as we start to invest in ourselves and truly learn to just kind of love ourselves well, just like we love our kids or our family, we realize over time that we're so deserving of that. And so that's my question for everyone. What is your one thing that you do for yourself? And I want it to be done weekly. Truly one thing you do for yourself weekly that is just for you, not for anyone else. Hot shower doesn't count.